Hi, I'm Dr. Tammy Post. I am a board-certified family physician, but I've worked with bioidentical hormones and in the field of hormones for almost 15 years. Being a woman who's had almost every hormone problem known to a female, I was really compelled to want to understand that, first for myself, but also to help my patients. I started out with terrible irregular menstrual cycles, polycystic ovarian syndrome, endometriosis, infertility, and finally ended up with an ovarian tumor that I thought was ovarian cancer and led to a hysterectomy. After that hysterectomy, I went on synthetic hormones and gained over 80 pounds. So I understand all of the things that are related to hormone imbalance. So when my patients come in, the first thing I do is give them a handout, and I ask them a questionnaire and ask them what's going on with you. Most people, especially menopausal women, think if they're not having hot flashes, it can't be their hormones. Hot flashes is usually at the bottom of the list. So more typical hormone imbalance things would be sleep. Sleep is very disrupted when estrogen progesterone balance is off, which is the main female ovarian hormones that usually are the culprits when we say our hormones are out of balance. So sleep is the first thing. Digestion can be off as well. So you can have intermittent constipation, diarrhea, what we call irritable bowel syndrome type things. And then fatigue, your energy levels just not what they used to be. Tired all day long, wake up tired. And then also, you're tired, but it's interrupted sleep, so it doesn't really make sense. Weight gain is huge. So when your hormones are off, too much estrogen or the wrong kind of estrogen in your balance without progesterone, you start to gain weight. And then cortisol gets unbalanced, so you start to gain weight around the center, the belly fat that comes on. So there are so many things, anxiety, mood disturbances, irritability, all those things can be part of hormone imbalance. So, sometimes when our loved ones say, you need to go get your hormones checked, that's usually at the root of it, the mood disturbances, the anxiety or depression. So many things associated. And then there are, hot flashes and night sweats and all those things. And those just don't have to be menopausal women either. And sometimes we just say, well, I just get hot all the time. Or maybe you're cold all the time. So if you have a thyroid problem and you're cold all the time, but then you have these other estrogen, progesterone imbalance, and then you're hot, so it all kind of balances out. So your temperature is really not the best indicator, but how you feel on a day-to-day basis. So I'd like to invite you to take a quiz. It's just a simple little quiz that you can take and just kind of see where you rate. I have lots of information for you and lots of things coming, future videos and books and information for you. So I've dedicated my life to really helping women understand hormone balance issues. So just take this little quiz and let's get you started on your path.